Hello, Assalamu alaikum. Today my topic is about dengue fever. So the dengue fever is a hemorrhagic type of fever and the agent of this fever is flavivirus, which is most commonly called as a dengue virus. It is a mosquito borne disease. So the most common mosquito which involved in this disease is Aedes aegypti. The incubation period of this virus is 2 to 7 days. What do you mean by incubation period? The incubation period means that the virus enter into the body and the symptoms that occur in the body and the time between the virus enter into the body and the first symptoms occur, so it is known as the incubation period, and it take about 2 to 7 days to produce symptoms within the body. So what is the pathogenesis of the body? Okay, one thing which is very important to know, that the mosquito which is the Aedes aegypti is most commonly breed on a fresh water and into the standing water. So the most common example is that there are a tire container in which the fresh water is present. So it can cause these disease wherever there is a such kind of things are present. Okay, or the water which is present in a tub. What is the pathogenesis of this virus? The most common thing which is the pathogenesis is that whenever the virus enter into the cell, so what it causes, that it fuse with the cells with the help of viral envelope E glycoprotein, and when it enter into the cell there is a disassembly into the RNA. As you know that the virus has envelope, capsids, nucleus, so all of these things will disassemble, and the RNA, which is the most important thing within the virus, will replicate. So it will replicate, it is called viral replication, and then this replication lead to the viral assembly into the same structure like envelope, like capsid, and then there is a viral maturation occur, and then it release from the body, it release from the cells and enter into the blood and cause symptoms. What do you mean by immunity? There are two types of immunity, homotypic and heterotypic. As you know that the dengue virus having a 4 serotype, and all of these virus cause same symptoms, same syndromes, which is known as the dengue fever or dengue hemorrhagic fever. So the type of the immunity is homotypic and heterotypic, means that homotypic immunity occur for a lifelong, because when one virus which is of one serotype will enter into the body, so this immunity which is known as the homotypic immunity will form against this virus for a lifelong. But the other three serotypes, for that there is a immunity will form for only 1 or 2 months, which is known as a heterotypic immunity. So it is a difference between these two immunity. So what are the clinical feature of this disease? First of all, there is the prodrome stage, which is known as that whenever there is a illness occur, so there is a mild stage of prodrome in which the patient is feeling uncomfortable, patient is having a feeling of illness. So it is a 2 days of malaise, which is known as a discomfort or illness like symptoms, and there is a headache. So the prodrome stage is of 2 days of malaise and headache. Then afterward there is a high grade fever, which is the bone break fever. What do you mean by bone break fever? It means that there is a generalized body pain, there is a arthralgia, there is a myalgia, so it is known as a bone break fever. And this bone break fever is for 7 days, and between these 7 days there can be a saddleback break fever. What it means, that saddleback means that the fever will subside for 1 to 2 days and then reappear, so it is known as a saddleback fever, and it can appear on 4 to 5 days. So there is a total fever of 7 days, which is a very high grade fever, and there is a generalized pain within the body. There is a pain on eye movement, which is a typical feature of a dengue virus, and there is a lacrimation also. There is a relative bradycardia. So this relative bradycardia is also seen into the typhoid fever. There can be a lymphadenopathy. There can be a rash which occur at 1 to 2 days, which is a macule. What is meant by macule? The macule is a flat, non-palpable lesion which is less than 1 centimeter. So there is a transient macule which occur on 1 to 2 days. Then there is a maculopapular rash, which means papule means that there is a elevated lesion which is palpable and less than 0.5 centimeter. So it occur in on 3 to 5 days centrifugally, means on from neck to trunk to lower part of the bodies, but it does not involve the palm and soles. So this is a sign of the dengue virus fever. So what do you mean by danger sign? Danger sign is also known as dengue hemorrhagic fever or dengue shock syndrome. So what do you mean by dengue hemorrhagic fever or dengue shock syndrome, or what are the danger signs of the dengue fever? So the pathogenesis of the dengue hemorrhagic fever is something very important to know, that in all the patient who got dengue fever does not have the dengue hemorrhagic fever, but in some patient they are prone to have the dengue hemorrhagic fever. So one pathogenesis is, one theory says that due to the immunity which form against the one serotypic fever which occur within the 18 months, and after 18 months the other serotypic infection occur within the body, so it can lead to the dengue hemorrhagic fever, because it can cause a very heavy viral load which can cause the antibody antigen reactions which lead to the formation of the dengue hemorrhagic fever, which can cause dengue hemorrhagic fever. And within the dengue hemorrhagic fever there are several signs which we see in the dengue shock syndrome or dengue hemorrhagic fever. Why we call it a dengue shock syndrome? Because there is a vascular permeability occur. There is a vascular permeability occur. So why this vascular permeability occur? It is due to that whenever there is the antigen present within the body, so the antibody antigen reaction will occur, and whenever there is an antigen antibody reaction occurs, so it will lead to the formation of the antibodies, and within the antibodies they will release many chemical mediator like cytokines like interleukin 1, interleukin 6, which will lead to the vascular permeability, increased vascular permeability, which will lead to the increased vascular permeability. And whenever there is an increased vascular permeability or damage to the vessel, so there is a leakage of the fluid from the vessels. Whenever there is a leakage of the fluid from the vessel, so it will lead to the hypotension, it will lead to the edema and many other features which will we see. So first of all, there will be the thrombocytopenia. Why it is a typical feature of the dengue virus, thrombocytopenia? Because whenever the antigen will come inside the body, so it will bind with the platelets, or the platelets body, platelets cell membrane having the protein which cross react with the viral antigen, and the antibody antigen reaction will lead to the destruction of the platelets, or some theories said that it will suppress the bone marrow work, so they cannot release much more platelets, so there is the thrombocytopenia, or the complement system will be activated, so it will lead to the destruction of the thrombocytopenia. And along with the thrombocytopenia there can be a leukopenia. So it is the same pathogenesis for both thrombocytopenia and the leukopenia, that the antigen will cross react with the platelets or white blood cells membrane, and antibodies cross react with the platelets or the white blood cells membrane. They think that they mimics with the antigen of the viral protein, so lead to the destruction of the platelets and the leukocytes. But also there are some theory that they say that they suppress the work of the bone marrow, so there is a decreased production of the platelets and the leukocytes, and there is a hemorrhage. Why there will be a hemorrhage? As you know that the thrombocytopenia is a major cause of the hemorrhage, so there will be a petechia, purpura, ecchymosis. So these all are the features of the dengue hemorrhagic fever and dengue shock syndrome. Why there is a hypotension? Because there is an increased permeability of the vessels, lead to the leakage of the vessels within the interstitial space, lead to the hypotension. There is a circulatory failure. Why there is a circulatory failure? Because there is a hypotension, so there is a circulatory failure will occur, and the brain does not get the blood enough to get its perfusions. Okay. Why there is a pleural effusion? Why there is a ascites? Why there is a hypoalbuminemia? The pleural effusion and ascites are due to the leakage of the fluid within the peritoneal cavity and the pleural cavity lead to the formation of the pleural effusion and ascites. In chest X-ray, you will see the pleural effusion and ascites is detected clinically or at ultrasound. Why there is a ARDS? ARDS means that this is known as a non-cardiogenic pulmonary edema due to any other cause which is not due to the heart, which is not due to the heart, so it is known as the ARDS. And the most important cause in this that the dengue antigen is found in the alveolar lining, and whenever there is an antigen antibody reaction occur, so lead to the destruction of the vessels or destruction of the tissue. So there is a leakage of the fluid from the alveolar vessels or lungs pulmonary vessels, so lead to the pulmonary edema, which can lead to the acute respiratory distress syndrome, and it is a life threatening condition. So how we diagnose dengue fever or dengue hemorrhagic fever? So there is only a one or two tests for that. There is a CBC, in which we will find that there is a leukopenia and the thrombocytopenia, which is the most important diagnostic feature for this disease. And this can also be occur into the malaria. So there are differential diagnosis for the dengue fever is malaria and the typhoid fever, because there is also a relative bradycardia and there is a leukopenia, because in typhoid fever there is a leukopenia and the relative bradycardia and the leukopenia. So how we confirm that the patient is having a dengue fever? So there are some tests which is for the confirmation of the dengue fever. There is a antigen NS1 test, which is very. So how will we diagnose this patient of the dengue hemorrhagic fever or dengue fever? So by the CBC, the diagnostic feature in the CBC is the leukopenia and the thrombocytopenia. As you know that there is an antigen and antibody mismatch occur, or the leukocytes or the platelets membrane proteins will mimics with the antigen of the viral antigen, so lead to the destruction of the leukocytes, and the platelets lead to the thrombocytopenia and the leukopenia. So the leukopenia and the thrombocytopenia are also found in the malaria and the typhoid fever. So these are the differential diagnosis for the dengue virus or the symptoms which occur in the dengue fever. So what is the confirmation test for the dengue virus? So one of the most important thing is the antigen NS1. So these antigen are found in the patient who is having the dengue fever, because the dengue fever or the dengue virus is having the antigen which is known as the NS1 antigen. There is a fourfold increase in IgG antibodies, but these IgG antibodies will appear lately in 8 to 9 days, so it is not useful. But the most important thing which is useful in the diagnosis of the dengue fever is antigen NS1, and if the antigen NS1 is not available, so we can do the PCR, which is the most important test for the confirmation of the dengue fever, but it is relatively expensive and it is relatively cheap, so it is preferred more, antigen NS1 in Pakistan. So this whole is about the diagnosis of the dengue fever. Now we talk about the management. So in the management, there is no any specific treatment for the dengue fever, and there is no antiviral present at the time for the dengue fever. It is usually subside within few days its own. So what we give the paracetamol for fever and pain. We will not give the aspirin. It is contraindicated or NSAID, because as you know that there is a thrombocytopenia, and when we give the aspirin or NSAID, so they are also inhibit the COX-1 or COX-2 receptor and lead to the decrease in the platelets adhesion with each other or platelets aggregation with each other, so lead to the more severe symptoms of the dengue fever. We will do the volume replacement. Why we will do the volume replacement? Because as you know that the patient is going into the circulatory failure or the hypertension or ARDS. In ARDS we will not do the volume replacement because there is a pulmonary edema and it will lead to the increase in the symptoms of the dengue fever. But we will do the volume replacement in the circulatory failure, and we will do the volume replacement in the hypotension. And whenever there is a very much decrease in the platelets, like the platelets has been come to 10,000 or 5,000, so we will do the platelet transfusion, or we will do the platelets transfusion in those